So now, next, discuss about the second type of conventional tumor cancer therapy. So a lot, like more than 2/3 of the cancer patient usually undergoes radiation therapy. So this is very, very important. So what is radiation treatment? That is a cancer treatment with the use of not just electromagnetic radiation, but it's very high energy, such as an X-ray or gamma ray, electron beam. So that we call as a ionizing radiation. So ionizing radiation means that the wavelength is very short, or the energy of the photons we are using is very, very high, that when it hits an atom, it can detach the valence electrons, and it can make the molecule or the atom to be ionized. And the ionized atom is very reactive, that it can damage DNA of the cells, nearby cells, and the cells can die easily. And the basic assumption and idea is we know that from comparison with a normal cell versus cancerous cells are usually more lacking the DNA repair mechanism. So if ionizing radiation hits both normal and tumor cells together, we know that tumor cells are more likely to die compared to normal cells. So by using this ionizing radiation to focus at the site of the cancer to damage and kill the malignant cancer cells. So radiation by itself is more like a local treatment, such as surgery, while we'll discuss later about chemotherapy or chemical. Systemic therapy is affecting the whole cells inside the body, while this one is more local treatment. So sometimes we know that this surgery is usually combined with radiation. So how do we use to combine to get a better result? So the radiation can have the surgery or chemotherapy become more effective by use of radiation. For example, you can see from literature or newspaper that adjuvant radiation therapy. What it means is adjuvant means it's a kind of helping. So when we are doing a surgery, surgical resection, there's potential for remnant tumor cells, and in this site we shine the radiation to kill the remnant tumor that we call adjuvant radiation therapy. But sometimes if the tumor is maybe so big or hard to resect, then sometimes we use radiation before surgery that to shrink the tumor, because radiation therapy is so strong. And so you shine the ionizing radiation to shrink the tumor to a size which is easier for surgery. In that case, we call this as a neoadvent therapy, meaning that the neo is a new. So we involve radiation first to shrink the tumor to help the resection. So the question is, how does ionizing radiation work as a radiation therapy? So the radiation with enough energy is to eject electrons from electrically neutral atoms. And these ejected free electrons can damage the cell, especially damaging what? The cell's DNA, and generate free radicals. These free radicals are uncharged molecules, which is very reactive, so that it can damage cells nearby. And the unit, how do we measure the amount of ionizing radiation? Radiation is thus so strong, and it has an accumulative effect on our cells, especially the damaging effect on the DNA. So we measure this as the amount of energy irradiated per unit mass or kilogram. So we use energy per mass or simply joule per kilogram as a unit of radiation. And there were English radiobiologists who was a pioneer for the effect of this ionizing radiation on the biological tissue. So following his last name, Gray, the unit, it becomes a Gray.